Hello, my name is Debra Enburg, and I'm a graduating student in mental health counseling at Capella University. I should mention that that Capella is one of the first online universities which is CACREP accredited in a couple of their counseling programs, and I have received comprehensive training in my particular field of studies. In this fieldwork interview, I will begin with presenting information regarding my educational and professional experiences and how these contribute to my present academic endeavors. I will then share theoretical orientations that I prefer, my worldview, and information pertaining to myself. So let's begin with my educational journey, which actually began a number of years before I began attending Capella University. I previously earned a Master of Science and PhD in Special Education, and following graduation, I provided services to students from elementary school all the way through college level, and began to notice that there was an increasing number of individuals who had both disability-related needs as well as mental health issues. But yet the provision of services were typically targeted towards serving one area while not the other. I therefore became motivated to return to school with the goal of becoming prepared to combine my pre-existing background along with mental health counseling skills to serve the concurrent needs of individuals having physical, sensory, or cognitive disabilities in addition to their mental health issues. Through Capella, I have been provided with academic and residential experiences that have prepared me to work toward meeting this professional goal. Next, we'll begin talking about theoretical orientation. And through Capella, I have been introduced to a number of theoretical approaches and have chosen to use an integrative approach to counseling. With some clients, I prefer using the solution-focused brief therapy, also referred to as SFBT, reality therapy, while also integrating some of Gestalt's techniques. I believe that for some clients, it is best to work collaboratively. As a consultant, I am in a position to be asking who, what, when, where, and how questions to support the client in identifying solutions to their problems or begin devising a plan. Gestalt techniques such as the empty chair method can be used effectively along with these approaches to assist the client in sharing a dialogue with an imagined person of interest. The client can then be asked to switch chairs so that they can be enabled to perceive things from the perspective of that other person. There are some clients, however, such as those who have experienced traumatic brain injury, post-traumatic stress disorder, or cognitive disabilities that can benefit from a more directive approach, such as the cognitive behavior therapy, also referred to as CBT. And this will assist the client to develop skills that are effective at dealing with their particular issue. In using CBT, I can work with clients to focus on errors of reasoning and how these are a source of their psychological problems. While using CBT, I can also incorporate training, relaxation strategy, or to teach them skills in the areas of relaxation strategies, social skills, assertiveness training, and communication. These skills can lead to the person being able to develop a more extensive network of friends or support systems. Exposure therapy is another technique which can be used when providing intervention for persons with PTSD or obsessive compulsive disorder, also referred to as OCD. This approach would have, I could have the individual engaging in vivo exposure or imaginal exposure and processing. The advantage of this approach is that the individual can begin to process their trauma, but in a therapeutically safe environment. Finally, while using SFBT, reality therapy, CBT, homework assignments are used to enable the client to generalize skills outside of the therapeutic environment to their naturalistic setting. With exposure therapy, such assignments will have the client exposing themselves to commonly avoided situations but outside of therapy. I believe that the therapeutic approach chosen will best be determined by the client's needs, the extent to which they understand they are presenting issues, or whether they need to develop additional skill sets before solutions can even be addressed. Okay, so let's move on to worldview. And I've come to realize that through life experiences, we become to formulate and consistently improvise our views of the world based upon the lessons passed on by family, friends, yes, foes, education, and spiritual beliefs. While addressing this subject in a paper, I began to believe that worldview is an unfinished tapestry that is continuously altered by our life stage, our newly developed attitudes, beliefs, and lessons that are learned on the pathway of existence. A quote by Woolman in 1973 stated that worldview is a term used to describe one's total outlook of life, society, and its institutions. Therefore, I believe that this is a principle that is subject to change as an individual has the opportunity to view life through alternative lenses. It'll be my responsibility as a counselor to engage in continuous exploration and realize that there will always be so much more to learn about the differences presented in human nature. My personal life, then, in addition to being a graduate student, my life encompasses a number of other roles as well. I'm a wife, mother of two grown sons, and I continue to fulfill the caregiver needs for my eldest son who is diagnosed with cerebral palsy. Additionally, I've worked the past 8 years as a human service specialist at a crisis stabilization center and also serve as a volunteer facilitator of a support group for individuals diagnosed with traumatic brain injury. Since attending Capella, I have begun to learn the importance of self-care. And I must say that in the past, I always put self-care kind of on that back burner. I would feel that it was more important to serve my family needs first and community needs. And then if I had a little time, I might engage in some self-care activities. However, I have now begun to realize how critical it will be for me to engage in self-care in an effort to prevent burnout and also to remain refreshed so that I can best serve the needs of my clients. A quote that I found from the American Counseling Association states that one of the most important skills counselors can learn in guarding against impairment is the regular practice of self-monitoring and self-care activities. And this is a process that I must say I will pursue with determination. In conclusion, I firmly believe that learning has no age restrictions, but when we no longer have the willingness to acquire new knowledge, then we no longer possess the desire to remain dedicated to serving the needs of our clientele. I am Debra Enburg, and thank you so much for listening.